Hello everyone, I am urologist Omar Makaya. Today, I have prepared a short video about the tests we perform for erectile dysfunction and the results we obtain. What tests must we perform for patients with erectile dysfunction? We definitely want hormone tests, friends. We also request a glucose test. By hormone tests, I mean those specific to the testicles. For example, testosterone and estrogen hormone levels must be measured. In addition, since the pituitary gland is an organ that produces hormones that regulate testicular function, the gonadotropin hormones FSH and LH, as well as the prolactin hormone, must be measured. Beyond that, if we want to be a bit more specific, tests such as SHBG, dihydrotestosterone, and dihydroepiandrosterone may also be requested from patients. We discussed free testosterone in previous videos, and there are some questions about this topic. According to treatment guidelines, it can be calculated using albumin and SHBG in calculation tables. In addition, tests such as B12, folic acid, and vitamin D must be performed. These are the simplest vitamin tests. Zinc and selenium can also be checked, but these are slightly less specific. Iron levels can also be checked in patients. Liver tests and kidney blood tests should also be performed at the hemogram tests. These are the most commonly performed tests anyway. These tests are usually performed on the patients who come to us, but unfortunately, I see that hormone tests are not performed in a significant portion of patients. The patient has only used 5 mg of tadalafil. In such a case, the patient experiences the following problem, friends. If we view erectile dysfunction as a wound, using tadalafil means covering the wound. But the underlying problem continues to grow slowly. The patient thinks the problem has been resolved for now. The patient is not addressing the real problem. Additionally, I have diagnosed many patients with erectile dysfunction who also had diabetes. Or they had prolactin disorders or low testosterone levels. We have resolved the issue for many patients by administering testosterone replacement therapy. Therefore, it is essential to perform these biochemical tests first. Then, we need to adjust these hormone levels to the optimal range for the patient to benefit. Apart from that, Doppler ultrasound can be performed, friends. We do not perform penile Doppler ultrasound on every patient, friends. Because it does not immediately change our initial treatment protocols. That's why we don't do it. The patient asks, "Doctor, won't you do a penile Doppler ultrasound?" Whether I do it or not when the patient first comes in, even if I diagnose venous leakage or arterial leakage, it doesn't immediately change the treatment I'll give first, friends. In addition, it is necessary to determine the degree of the patient's erectile dysfunction. We talk to the patient. We ask certain questions. We give the patient a certain score. We ask the patient how many times they have had intercourse in the last month and in the last 6 months, the duration of intercourse, their level of satisfaction, and their level of anxiety. Then we create a scale in our minds regarding the patient's erectile dysfunction. We generally divide patients into 3 categories: mild, moderate, and severe. Those with mild erectile dysfunction sometimes benefit from using PDE5 inhibitors such as tadalafil or sildenafil. Sometimes they don't use them. They can still perform. Unfortunately, those with moderate erectile dysfunction cannot engage in sexual intercourse without medication. Those with severe erectile dysfunction cannot achieve significant success even with medication. Of course, once the severity is determined, the treatment protocols we apply are quite different for each group. Unfortunately, erectile dysfunction is not only physical, but can also be caused by psychological factors in many cases. It is also important to thoroughly assess the couple's relationship. If there are feelings of hatred or anger in the relationship, these need to be addressed, friends. Thank you for listening. Best regards.